Drishti Eye Care Center in Nepal. And she works as a specialist and cataract surgeon since 2020. That says 23, but that's probably wrong because it says you've got more than 13 years of experience. So it's not 23 that you started working, I'm pretty sure. She's worked as a medical director in Banipa, Nepal for 4 years from 2019 to 2023. And hopefully, yep. And so your presentation is going to focus on the referral pathway for retinal services among diabetic patients.
I'm Dr. Ruchi Shrestha. I'm not a researcher. I'm a completely clinical person. And this is my first operational research. And this was done with the collaboration of the Operational Research Capacity Building with the help of SEVA and Indian Institute of Public Health, Hyderabad. And my topic was augmenting the referral pathway for retinal services among diabetic patients at Reiyukai Eiko Masunaga Eye Hospital in short REMH, Nepal. And it was a non-randomized pre-post intervention study. So coming to the background, as we all know that diabetic retinopathy, it is an important public health issue in Nepal. And despite of availability of the retinal services, we found that many people are not assessing them because maybe due to the lack of knowledge of the diabetic retinopathy and poor referral systems. So we try to focus on improving the DR awareness among general physicians, which has the potential to address these challenges. And our research objective was to increase the retinal screening uptake among diabetic patients by augmenting the referral pathway in a selected hospital in Nepal. And this was a non-randomized pre-post intervention study design, which was done at REMH Banipa for a duration of 16 months. The first 8 months was for the baseline data collection, and the next last 8 months, it was for the post-intervention data collection. And our participants were health personnel of Sir Memorial Hospital, which was about 1.5 kilometers from our hospital, and it did not have an ophthalmology department. And we only selected those persons who were involved in the diabetes mellitus management. And we had altogether 14 participants. We had a very less number of sample size because of this study was done totally during COVID-19. We had 10 physicians, and we also included the non-physicians, which were the assistant in the pediatric and medicine department. And we had 3 health education sessions which were provided on diabetic retinopathy to the health personnel of the Sir Memorial Hospital at an interval of 1 month. And we gave them IC materials in the form of PowerPoint presentations on diabetic retinopathy, posters on diabetic retinopathy. We also distributed pamphlets, showed them videos, and we also provided them referral slips to refer the patients to our hospital. And we also conducted a small pilot in another hospital so that our main health education session will go smoothly, but it was only 2 of the participants came from the pilot, but although it helped us to make our main health education session go effectively. So we did a pre and post evaluation through a questionnaire which was provided on diabetic retinopathy on the first session before they were given the health education, and on the last session after the health education sessions were complete. We also took the written informed consent as well as ethical approval from the NHRC board. And these are few pictures we took during the health education sessions. We can see that most of the people are wearing the mask because it was completely during COVID-19, and very few health personnels were interested to come. And this is the group photo taken with the health professional of the Sir Memorial Hospital with the REMH research team. So our data collection, it included the pre and post intervention scores of the knowledge of the health education session, as well as the number of referral of the patient from the Sir Memorial to REMH. And our primary expected outcome was supposed to be the change in knowledge level of the healthcare personnel who participated in the health education sessions from the Sir Memorial. And our secondary outcome was supposed to be the increase in proportion of referred patients from Sir Memorial to REMH when compared to the baseline referrals before the intervention. So these are our results, which was also completely done with the help of the statisticians from the Indian Institute of Public Health, Hyderabad. So table 1 showing the socio-demographic profile, because there are equal number of male and female, and this does not show any much significant in our study. And in the table 2, we can see that there is a significant change in the knowledge level of healthcare personnel at the pre and post intervention based on the questionnaire we provided them at pre and post intervention. And the table 3 shows that there is a significant number of increase in the proportion of referral to REMH from the Sri Memorial in the pre and post-intervention period. So our final outcome was that the pre-intervention attendance among referral was 50% before the pre-intervention, but it increased to 95% after the post-intervention. And also the mean score of the knowledge gained by the physicians on diabetic retinopathy awareness was also more at post-intervention than the pre-intervention. And we had various research challenges and overcoming them. This was our first operational research study, and we didn't have any idea like on what topic to decide and how we are going to do the project. So we were trained in the operational research capacity building project with the experts from SEVA and guides from Indian Institute of Public Health, Hyderabad from 2019 to 2021, and it was completely a COVID period. And we are completely new to the research. We didn't know what is the research, what is the operational research. We knew few idea about the clinical research, but we never had done any operational research. And also there were very few people who were interested in this, that what is gonna help to our institute or on the personal level. But the ORCB project, it helped us from the basics of research till its completion and as well as the publication of our research. And so we started from the basic till the publication of the research. So we even had a challenge in deciding the title of the research. Like we were wondering whether we would decide on the low surgical acceptance of cataract, or whether the proper utilization of a hospital-generated data, or whether the low uptake of retinal services. Then Priya from SEVA Nepal, I'd like to thank to her, because she was the one who helped us notice that we should prioritize the retinal services, which was the main need of our hospital, because retinal services were regular from 2019 in REMS, but there were very few retinal patients in the hospital. And so we finally did our problem tree analysis and came to do this project. And also because of the COVID-19, like we did all the this ORCB project online, and we all could not meet physically at all during this whole project. And also the other challenge for REMS Banepa was that there was no good record system in Banepa. So the baseline data was not available at the study. So we were having challenging like how to get the data. So this study was supposed to be a case control study between two hospitals, but then the study design was changed to a pre-post intervention design, and we divided the 16 months into two parts. And so finally this was how we got our data collection. And also, even after doing the research, there was a huge question on the sustainability of the change in knowledge. Could be the only way the physicians would refer the diabetic patients. And so, to maintain this, we decided to do a 3 months post survey to the physicians. But since the second lockdown was still continuing, so we sent the questions online to the physicians and assistant, and we found that there was the same significant change. But still, I think this is the demerit of our study, that we do not know how to sustain this research after 3 months. So I think if there are some suggestions from the audience, you all are welcome. And I think I'm not a researcher, or I'm better clinical researcher than an operational researcher. So I think advices are welcome from all the side. And so the strength of our study is that it is one of the few studies in Nepal that addresses healthcare professionals involved in DM management and strengthens the referral for screening of diabetic retinopathy. And the pilot we did also gave us information on the recomprehension of the content of materials to be used for the study. So I already told that COVID-19 was a great limitation for our study. The study which was proposed to be a control hospital changed into pre-post intervention design. And I think further qualitative studies with a greater sample size needs to be done in future. And so the conclusion of our study was that a well-planned health education intervention increases the knowledge in physicians about diabetic retinopathy. With the increase in referral mechanism and knowledge, there is an increase in number of referrals and attendance of patients for eye checkup. And this study also shows the need to mobilize the link between the physicians in general hospital and eye hospital in the future. So finally, we published our protocol in JMIR research protocols. And after completion of our study, we also published our original article in the BMC Health Services. So I'm very proud to be a part of it. I'd like to thank the ORCB project team from SEVA and all the guides from Indian Institute of Public Health. And our institute personal guide, Dr. Saileja, she is here. Thank you so much, and thank you.